Have you ever had a difficulty with deciding which nurse practitioner specialty you want to pursue? In this video, I will explain 5 tips to wisely choose nurse practitioner specialty that works for your career goal. Hi, I'm Miki Miura, a family nurse practitioner based in Hawaii. I'm the founder of JNP Project. In this video, I will explain how I chose my nurse practitioner specialty and some tips to help you decide which specialty certification works for you. First thing you should consider is what you love to do and which clinical field you love to work in. The best way to find this out is to actually work in the field, either as a nurse or other healthcare professional. I cannot remember when I decided that I wanted to pursue a healthcare career exactly, but I think it was when I was in middle school. My grandfather was a physician, and I looked back to his devotion to his patients, and I wanted to help others like him. Then I found out pediatrics was my passion when I was in high school. I decided on what profession I wanted to get into, and I decided that I wanted to help children when they have tough times, just like how my family helped me when I had a tough time in my life. When I went to a nursing university in Japan, I did some volunteer work to accompany children whose siblings were hospitalized. Their parents needed a babysitter for them while their parents are visiting the sick siblings at the hospital. Those children could not visit their siblings for infection control purposes. Through this volunteering experience, I became confident that pediatrics was really where my heart belonged. So when I applied to hospitals for a registered nurse job after graduation, I decided to work for hospitals that would let me work in a pediatric field. Luckily, I got a job at a university hospital in Tokyo, and I got a staff nurse position at a pediatric ward. The job was hard, especially because I was just out of nursing school, but I loved working with children, and I was convinced that pediatric nursing was my calling. I always wanted to come to the US to study like my father did since I was little. I decided to move to the States to advance my nursing career when I was in a nursing program in Japan. While I was in nursing college, I started to consider becoming a nurse practitioner. An alumnus from the university who became a pediatric nurse practitioner in the US came to a campus and lectured us on what she does as a nurse practitioner. Listening to her story, I was convinced that I wanted to be a pediatric nurse practitioner like her because I loved working in the pediatric field and wanted to become a nurse practitioner and take more responsibility in a healthcare team. It is important to first figure out if you have a particular interest in a specific healthcare field. If not, that is fine too. Most important, the thing is to clarify which particular healthcare field you want to work in, or if you don't mind trying working in a new field. Second thing to consider is to figure out where you are open to living. Would you be open to living anywhere in the first several years of your nurse practitioner career? Or do you have specific places you prefer to live in? For me, I was determined to move to Hawaii. I couldn't think of anywhere else that I liked to live. Some people told me that I should have moved to the mainland US, like New York, for better nurse practitioner schools and career opportunities, but my mind was already set. Whether you are particular about where to live or not, that's totally fine. The important thing here is determine what works for you, because this decision will lead to the next step. The next step is to research which nurse practitioner specialty has more demand in the community that you want to live in. If you are open to live anywhere, then you have more opportunities to find jobs that you really want. But if you have specific preference of where to live, like I was, then you may want to be flexible with your nurse practitioner specialty. For example, I loved working with children, like I said earlier, but I was open to try working in a different healthcare field because I couldn't give up on the dream of living in Hawaii. When I was looking into nurse practitioner programs, I talked to multiple people who worked in the healthcare industry and found out that the demand for pediatricians in Hawaii was fulfilled and the demand for a pediatric nurse practitioner was low at that time. Indeed, I met a lot of pediatric nurse practitioners who had difficulties with finding jobs. One of my classmates had a hard time finding a job as a pediatric nurse practitioner in Hawaii and went back to school to get an additional certification as a family nurse practitioner to gain more job opportunities. After hearing these stories, I decided to get into a family nurse practitioner program instead of a pediatric nurse practitioner program because I knew that I would have a harder time to find a job as an international student. I needed to make sure that there will be plenty job opportunities after I graduate from the program so that I wouldn't end up not being able to find a job and moving back to Japan where nurse practitioner profession is not legalized yet. This way, I would still get to see pediatric patients as a part of family practice, but I would have more job opportunities. I really wanted to move to Hawaii, and moving to other states wasn't an option, so I had to be flexible in my choice of nurse practitioner specialty. I personally think this was one of the best choices I made in my life. I indeed got multiple job offers in different healthcare fields after graduation. I was actually one of the first people to secure a nurse practitioner job among my classmates, despite that I needed to find an employer who was willing to support me to obtain a work visa. As some of you know, I ended up working mainly in the women's health field. It was a struggle to learn from zero when I first started working at an OB/GYN office because I only had one semester to learn about women's health during the family nurse practitioner program, and my boss had to teach me from scratch. But I have grown to love this field of women's health, and now I feel competent with my skills and knowledge as a nurse practitioner in this field. Another advantage of choosing family practice path is that I can meet various needs of my patients. Many of my patients don't have a primary care provider because they are healthy for the most part, and their only needs are for pregnancy, pap smear, and birth control most of the time. But they do get sick or have health problems time to time. I feel comfortable to take care of their primary care issues as needed because I was trained to take care of those problems in school. Another advantage of choosing family nurse practitioner path is that I can choose to work in a different healthcare fields. I can work at urgent care as a side job if I want to, or work in a completely different healthcare field if for some reason I needed to move and there are no jobs in the women's health field in the community that I moved to. But I don't think everyone should go into family practice, because the disadvantage of going into family nurse practitioner program is that your knowledge and skills in one particular field will be limited, as the program needs to cover multiple healthcare fields and have limited time to allocate for a specific field. For example, if a person is certain that the clinical field the person is interested in is only behavioral health, then perhaps the person should consider going into a psychiatric mental health nurse practitioner program so that the person will deepen knowledge and skills specifically in that field. But you can also become a family nurse practitioner and work with an employer who is willing to train you in a specific field or go to a residency program for a specific clinical field. other option is to go into dual programs where you can obtain multiple specialty certification in the end. Studying for just one specialty is hard enough. So of course being in a dual program will be harder, but it can be the best investment for your career. Final tip is do not limit yourself. If you think that you went into a wrong certification program or want to change your specialty, you can also get into postgraduate program where you can obtain a certificate in a different specialty without redoing your entry nurse practitioner education. I know multiple nurse practitioners who did this. One person who was a women's health nurse practitioner who then got a family nurse practitioner certificate later on. Another person got a family nurse practitioner certificate first, then got a psychiatric mental health nurse practitioner certificate because she wanted to focus on behavioral health services. I strongly believe that no experience is wasted, especially in nursing. So even if you change your specialty, your experiences from the original specialty will be still very helpful. I hope this video was helpful. Deciding on which nurse practitioner specialty programs to get into can be tough, but you can make your decision wisely with these tips. If you enjoyed this video, please like this video and share your experience in the comment section. Also, I upload a new video every Sunday, so please subscribe to my channel so you won't miss any new videos. See you in the next video.